Well, there are new guidelines this morning when it comes to screenings for lung cancer. The American Cancer Society now says adults over 50 with a 20-year smoking history should be screened every year, regardless of whether they have quit smoking or if they still smoke. Dr. Eric Hart, clinical director of the Northwestern Medicine Lung Cancer Screening Program, joins us live. Dr. Hart, welcome. Thanks for joining us.
Good morning, and thank you for having me.
So how have these new lung cancer screening recommendations changed from what existed previously?
Primarily by removing the quit restriction, we've opened up eligibility to a larger number of patients who may be at high risk for lung cancer. And I think that's a message of hope from the American Cancer Society.
For people who don't smoke, is there any concern for lung cancer in that population?
Unfortunately, we know that about 15 to 20% of lung cancer occurs in people who don't smoke, but at the current time, we don't have any established method of trying to determine who those people may be. I think that's a subject of future research, but for right now, just your routine preventative health care is the best we can say about that.
You mean just going to your doctor annually for a checkup?
Absolutely. For those who have had a smoking history, I think screening is the #1 choice. But for those who do not have a smoking history, seeing your doctor annually, talking to them about your symptoms in your life is the best thing you can do.
Can you tell us about any symptoms that people should watch out for?
Lung cancer symptoms can include things like an unexpected weight loss, a new hoarseness, a new chest pain, or sometimes coughing up of blood. Those are all things that should prompt an immediate doctor visit.
And then you have a lung cancer screening event coming up. What can you tell us about that?
Yes, on National Lung Cancer Screening Day, which is November the 11th, a Saturday, we're open for lung cancer screening to those who have an order from their doctor to come in. And the reason we want to have this on a Saturday is to increase accessibility for those who might otherwise be working during the week and unable to get a lung cancer screen during quote unquote normal business hours.
Dr. Hart, one last question for you. Why is early detection so important?
Early detection really gives us the best opportunity to find lung cancer when it's at an early stage. And so if it's an early stage, we have the best opportunity to provide effective treatment and potentially even curative therapy.
Okay, Dr. Hart, thank you so much for bringing awareness to this and to your event that is coming up Saturday, November 11th. National Lung Cancer Screening Day takes place at Northwestern Memorial Hospital. We have more information online at abc7chicago.com. We'll be right back.
Thank you.
Thank you.
Watch breaking news on YouTube. Subscribe to ABC7 Chicago Eyewitness News.